Every Saturday at 10 a.m., we bring the Home Healthcare Today show, hosted by Dr. Clemon Moore and sponsored by Meridian Health Plan in Michigan. We bring health and wellness topics straight to you. Tune in at 10. That may say, hey, I feel as though I'm more technically aligned or more technically acclimated to be a computer scientist or to be an engineer per se. But that does not necessarily derail them from pursuing healthcare or pursuing a role in medicine. Speaking of which, brain-computer interfaces, Dr. Wilsey. What are they, and how can it help someone survive and perhaps rehabilitate as related to traumatic brain injury?
That's another good question.
Sure.
So I think to think about what is a brain-computer interface, you have to think about the people that they're designed to help.
Yes.
So for somebody, let's take an example. Somebody is in a motor vehicle accident. They've sustained a trauma.
Yes.
They can sustain a trauma to their brain and also to their spinal cord.
Sure.
Unfortunately, in some cases, the pathway between the brain and the rest of the body can be disrupted. This can be from a brainstem injury or from spinal cord injury.
Yes.
So even though somebody knows what they want to do, say maybe they want to move their arms or their legs or they want to produce the sounds of speech,
Yes.
but they're not able to do that,
Yep.
that's because of the injury, and that's what brain-computer interfaces are designed to try and do. So with a brain-computer interface, you try and put a device around the brain, record the electrical activity from the brain,
Yes.
and use it as a bypass to either control a device, like control a computer or a robotic arm, or potentially one day even reanimate someone's own arms or legs.
Wow.
With the types of brain-computer interfaces that we work with, we try and get electrodes in and around the brain. They pass into a computer. We train the system to learn what someone's trying to do,
Yes.
and use it to control devices, computers, robotic arms.
Mm.
And so that's,
Yeah.
I hope that answers a little
Totally,
bit of
totally,
the
yes,
questions you're-
absolutely. and I will not butcher that or try to paraphrase it in a re-explanation. But I totally get it, and I'm confident that the listeners and viewers of the podcast, as well as the television show, kind of got that movement starts in the brain. The desire to move, to articulate something, to say something, but catching the neural networks, the wavelengths within the brain, and then connecting that to robotic, arms.
robotic arms or computers.
Legs.
Yep.
Wow. So there's hope. There's lots and lots of hope. Very good, Doc. Okay, University of Michigan in 2025 developed the clinic, and I think we met via reading about an award, the notable leader in healthcare technology through Cranes last year. So I read, the work there and reached out. That clinic is the first in the nation. Dr. Wilsey, you lead the clinic. What does this mean for patients in Michigan and beyond?
Yeah. That's a good question, and the clinic I think we're one of the first. I don't know that we were the first, but we are one of the first. And the idea is to there's a patient population out there, people with paralysis,
Yes,
people with motor and speech disabilities, and for a long time after the acute injury and the rehabilitation period. There's like a plateau in functioning. And
Yes.
after that, then what do you do? Well, most of the therapies have focused on, accommodating to the injury and trying to make the best of the function that people have left. But what we wanted to do is with these new devices that are coming online, they're coming into clinical trials.
Yes.
There's some new FDA approved indications for implanting devices for rehab. We wanted to form a multidisciplinary clinic around these patient populations so we can begin to think about what are surgical indications, what are the right clinical outcomes, how do we know whether the surgery is a success,
Yes.
and with the clinical trials, how do we connect people with a disability to a clinical trial that may be going on maybe at Michigan but maybe somewhere else in the country. Where they're testing devices that could help. Maybe they're testing the initial safety or feasibility of the device, but a lot of people themselves that have the lived experiences want to actually get out there and help move that technology forward.
Absolutely.
And so our role in the clinic is to try and, be kind of the boots on the ground and help people connect into these resources in these ways.
Wonderful. So, Angela T. Moore, with years of experience in the mental and physical health industry, integrative health expert Angela T. Moore has helped countless individuals strengthen their minds and bodies through an integrative health approach, using proven therapeutic interventions, effective exercise methods, and healthy lifestyle strategies. Angela holds several degrees, licenses, and certifications in counseling, nutrition, sociology, business, exercise, and performance enhancement. Angela is the founder and CEO of the Body Principle, which provides integrative health presentations, workshops, mental health counseling, and integrative health coaching to organizations and school systems. Angela is also the founder and CEO of Empowered by Angela, which provides education, information, and resources to empower individuals to achieve mental and physical health and overall well-being. Angela, welcome back to the Home Healthcare Today show.
I'm happy to be here today. Thank you so much for the invitation.
Oh, glad to have you back, Angela. So as we think about those New Year's resolutions that a lot of us had, and now we're a few weeks into it, I fell off the wagon. And I imagine that a couple others have. So Angela, talk to us about the mind-body connection. Because you're both a mental health counselor and a master trainer, which is a very unique combination.
Thank you.
Why is it impossible to talk about healthy weight without talking about our mental health?
Well, it's so funny. One of the things I recognized as a trainer many, many years ago, and I had a full studio that I opened up in 2008. And one of the things I recognized as I was training clients, many of the times when they would say or express gratitude for the results that they were getting, they would say, not thank you for losing weight, but they would say, thank you for helping me during that very difficult time in my life. Thank you for helping me deal with the stresses of my life.
Yes.
And one of the things that I recognize is that when you exercise, when you take better care of yourself, you're better able to deal with anything that life presents you. I always say when you're strong and stable, and it's funny because there's a principle in performance enhancement, which a lot of people don't know. In order to exert force in any range of motion, you need to be stable first.
Absolutely. Yes.
And so ironically, as I was training clients to be stable so that they're able to exert force,
Yes.
I'm also stabilizing their mind so that they're able to move powerfully in significant areas of their life.
Well, wonderful. Thank you for sharing that, Angela. And that, range of motion, of course, we do that when we look at physical therapy for a lot of our homebound folks out there. Coming off the holidays, there might have been some emotional eating, right? So emotional eating as a reality. So many people struggle with emotional eating from time to time. They may use food to cope with stress. What's actually happening in folks' minds? And how do we begin to break the cycle of emotional eating?
Yeah, well, oftentimes we gravitate to the foods that have brought us joy in the past.
All right, come on, fried green tomatoes. Let's go.
Yeah, and
Yep.
when we associate certain types of food with happier times when you're feeling sad, you often would gravitate to those foods that gave you peace and joy. I actually am not a fan of diets. I'm a big fan of healthy eating that you maintain all the time with occasional scheduled splurges.
There we go.
And so if you eat healthy all the time and then you occasionally schedule in those splurges, you're less likely to, when you're feeling a certain emotion, to try to feel that emotion with food.
Absolutely. For sure. I like it. Many viewers, to your point, like about not liking diets, many viewers have tried every diet, right? And feel like the failure or failures, what do you want them to understand about the relationship between, hey, your weight and self-worth?
Well, it's funny because one of the things I've recognized is whenever you're overwhelmed, whenever you're overweight, let me correct that, you typically are overwhelmed, emotionally.
Yes.
And it's your weight is an indication of what's going on internally.
Got it.
Yeah. And so if you're able to have someone help you kind of process your emotions, help you gain a better understanding of why you feel a certain way and why you choose to eat to address the negative emotions that you're experiencing. A lot of times then you can really take the necessary steps to, over time, in a healthy way, decrease weight and get to a healthy weight. And then with the self-worth, I find that when you value yourself, you know, you will, I would say, make a commitment to doing the things that basically, and I try to think how to say this. When you love yourself, you know, you will do the things that are necessary to keep yourself healthy.
Never in the history of healthcare delivery has an organization offered such complete care to Detroiters. Your eye care experience may begin in our state-of-the-art eye clinic, but it doesn't stop there. We can come to you. Delivering vision and home health care is the hallmark of the Eye Care for Detroit and American Advantage partnership. Helping you to feel better and see clearly is the perfect putt. Call Eye Care for Detroit today. What are some of those benefits, team, that Meridian offers that a lot of moms just don't know about?
Yeah. It's so important because as a new mom, you're not sleeping very much.
Not much.
So let's not forget what these are.
Yep.
But
that's
things
right.
that for sure can help with that are unlimited doula benefits, like Shanita had mentioned.
Yep.
We have dental visits, maternal infant health partnership visits. That's a visiting nurse that can come out to your home.
Yep.
Smoking cessation programs that we offer.
Very good.
We do offer group prenatal care and resources with helping you get in touch with a group that will be personal for you. Transportation, we do offer rides through our partner to any appointments or even to the pharmacy to get your medications.
Yep.
On that note, we also cover prenatal vitamins.
Okay.
And with transportation, if you do have your own vehicle, we also provide gas mileage reimbursement through that partner too.
That's good.
We offer durable medical equipment, so things like blood pressure cuffs, breast pumps, glucometers if you're diabetic. So important to have those things in order to be on top of your own healthcare and to advocate for yourself.
Certainly.
In terms of like socioeconomic needs, we are able to help, and please call into Meridian if you have any needs. But anyone at Meridian can get you in touch with any resources for housing, food insecurity, employment and education, utility needs like heat, especially in this weather, shelters, mental health, and domestic violence is very prevalent, unfortunately. And then we have our community health workers who are employees of Meridian who are able to go out into the field and actually work with members in their home. Those healthcare workers are actually living in the communities they work in, so they are subject matter experts for all of the resources you may need. And I think that's all I have that I can remember.
Well, that's plenty. That's plenty, Sarah. Thank you. That's plenty. So as I think about those resources and support, it gets a mom to delivery. But we do understand that after delivery, there are some challenges. I can think back to my undergrad days and meeting one of my, new friends in the dormitory, and we were going over our life stories and backgrounds, and he shared that, hey, my mom passed, and we, of course, gave our condolences, and we thought it was recent that she had passed. He's like, no, man, she passed like right after I was born, like the next day or so. So let's spend a little bit of time there. How can we, look at some of those deaths that occur in the same week, and how's Meridian addressing postpartum care and follow-up?
Yeah, this is a topic that's very important to me too.
Oh, yes.
As a personal topic, but yeah, it is true that deaths occur within most often within the first 6 weeks after delivery. So Meridian does offer 12 months of benefits after birth. So that's very important to be able to get in everything that you need for yourself as a new mom. But we do have our care managers and all the other health plan staff that we're all working together to reduce their barriers to care.
Yeah.
Postpartum visits are so much more important than one may think, and we really want to reduce those barriers to getting to those visits. And why is it that someone may not be going? Is it transportation? Like we said, we offer transportation. Now, is it childcare? Is your provider letting you bring your child to the appointment? We can help with some resources like that. And then, is it just the belief that hey, this isn't important. I feel fine. I should be fine.
Right.
Because providers are doing a constant assessing and are being able to look for things that we may not know is going on outwardly.
Absolutely.
Postpartum depression is very prevalent nowadays as well. I shouldn't say nowadays because it probably always has been.
Yeah.
However, it's more assessed for and more bringing more awareness to it, which I think is wonderful. But even at Meridian, we are assessing for postpartum depression through a couple of assessments after delivery, and based on your scores, we can offer resources and connect with your provider to let them know what is going on and any support that they may be able to help with too. I would be remiss without mentioning doulas in this space too. Doulas help out with the postpartum period and are able to be the eyes and ears in the home.
Sure.
Help out with any resources, and then I guess again with the care management team, we are assessing for signs and symptoms that may be concerning.
Absolutely.
You mentioned unfortunately your friend's mom, and I wonder if somebody had assessed for something that was going on. What could they have caught early? So definitely keep in touch with your care team at Meridian if you do have one, and let us know what's going on.
Encouraging. I got to connect back to home health, right? And looking for advice, as president and CEO of American Advantage Home Care. We do a lot in the community to help out folks. Usually when people think home health, they think, okay, the seniors and nursing care, as well as the therapies and the like. But yeah, we take on moms as well. And how important is home health to moms?
Oh gosh, it's convenient.
Yep.
All those barriers I had listed, but I think aside from the convenience, the doulas and the maternal infant health program nurses that are able to come out to the home and visit, they're really the eyes and ears for you, and can see what's going on, can do those quick assessments in person. Now Meridian does make a referral to the MIHP programs, which is the maternal infant health program, upon notification of pregnancy. So likely, if you are pregnant, this program through the state would be reaching out, and now you do have the right to decline that. But again, it's very helpful having a visiting nurse to come in, and so postpartum they can assess for things like they can help with breastfeeding, developmental milestones for your infant, sleep safety, car seat safety, things like that are just so important.
So important. Oh man, we're gonna have you all back throughout. I mean, because it is so such an enriching conversation and enlightening, and there's so many concerns that folks have about bringing a new life into the world. One of which is birth weight, Shanita. So we'll spend a little time on that, right? Low birth weight and health disparities. What are you seeing, and what can Meridian and organizations like American Advantage and other partners do to assist?
Well, low birth weight, I think we should start by understanding what low birth weight is.
Yes.
So low birth weight is any infant that is born weighing 5.5 pounds or less. And low birth weight, when you're born that tiny, it's one of the strongest, earliest indicators of some short and long-term health complications.
Sure.
Infants that are born at a lower birth weight, they tend to have complications with breathing, asthma, they have feeding challenges.
Yes.
Because of their underdeveloped immune system, they tend to have more infections. Low birth weight, not only in the short term, to physical, neurological development on that small baby, but it tends to lead into having some health complications in adulthood, such as kidney disease, type 2 diabetes, and also hypertension. So it's, you know, it's just a full spectrum of health complications that we want to reduce and eliminate. So with regard to Meridian, we are targeting and we take low birth weight serious. So what we do is we use our data and we look at those populations where low birth weight is more prevalent. And together with Sarah's team as well as other departments, we work collaboratively to do like comprehensive analysis of those individuals that were impacted by low birth weight, getting a full understanding of what they encountered. Also getting a full understanding and fully investigating root causes, systemic root causes, but also understanding like the footprint of those individuals. You know, did they have stress? Did they express any social determinant of health needs? You know, any of those things. And then we take that data and we work to develop solutions and interventions that address those things for those coming down and experiencing that in an effort to reduce and eliminate low birth weight. So it's a comprehensive approach, as I said. We're working with May Health, we're working with our doulas, but we're also working with other community partners, and we're working with our clinicians, our OBGYN specialists and other perinatal providers. We're having deep dive conversations with them, understanding, asking the questions of what's contributing or attributing to the low birth weight deliveries that they're experiencing. And then we're working with them very collaboratively to address those barriers that physicians experience. So it's basically just a wraparound, you know, care of truly understanding the data and then using that to back into evidence-based, culturally relevant solutions.
Meridian's a great partner to do great work in the community. But you're right. So it's so important to know information about the neighborhood where you live. AHA has promoted this. Others have said this. Sometimes your zip code is more important than your genetic code, right? We have areas all across the city of Detroit where people are dying 5 to 15 years younger than the state average. Just along the border of Grosse Pointe to Detroit, some folks are living to 80 and some folks are dying at 60, and that's a shame in the wealthiest nation in the world, right? But what we can do is better understand the communities that they come from so that we can apply proactive outreach, proactive response, proactive work to mitigate those risks, right? And so we created a program at Wayne State called Phoenix, the Population Health Outcome Information Exchange, which allows us to pull in health data, social determinant data, environmental data, so we can know what risk factors specifically contribute in what geographic locations to the health problems that we're seeing. And instead of just focusing on the end result or the end manifestation like heart disease or, in your dad's case, heart failure, let's get upstream. Let's see what's contributing to the stress in the community, as we were talking about. What's contributing to perhaps environmental exposure to air pollution, noise pollution, whatever it might be. Maybe there's poor transportation in that area and we'd like somebody to be able to go to a doctor, but they can't do that. So we can use that information to target outreach and know what to do before we even get into those areas. And that's the basis of the mobile program, as we've talked about for iCare for Detroit and for the Wayne Mobile Health Unit. It's really important to be purposeful where you're deploying. It's really important to be able to reach people with things that they are going to be receptive to.
Absolutely.
Data is everything.
It really is, Sarah.
We use Phoenix too.
Hey,
my team uses
go.
it when we are looking about what we're doing in the community. It is so important.
Absolutely.
And to all the viewers, anyone can go to the website, search up Phoenix at Wayne State, and the tools we have, the data information is freely available to everybody.
Yep. And it's trusted.
Yes.
It is a trusted source.
Thank
You know, and that is such a helpful resource. And, you know, shout out to our new mayor, you know, Mary Sheffield, right? Looking at health and wellness, but also looking at the determinants of health, social determinants, and saying, hey, poverty, we can alleviate poverty. We can address homelessness and bring solutions. So I love this work. Sarah, that's the segue to advocacy. Talk to us about how do we advocate for some of these individuals out here that fall into various buckets, who may not have a voice or may go to a doctor or in a doctor's office and say, I don't think my doctor's hearing me, or I don't think I'm being understood.
Yeah.
How can we advocate better?
Yeah, you really have to trust yourself to speak up. You know, advocacy, I think about advocacy on two levels, right? So you're advocating for yourself at the local level, at the doctor's office, at a variety of places. Parents, we advocate for our kids at school. And then our organization, we're advocating at the city and statewide, as well as the national level, for overall well-being in our state. Yeah. So my team has a state advocacy director, and we have worked tirelessly on things like healthy school meals for all. And every cycle, that funding is at risk. And when we think about healthy meals, and when we think about nutrition security and our children and how important that is. It is the fundamentals. I mean, if our kids aren't fed at school, how are they going to learn?
Absolutely. Absolutely. That's it. So there's that connectivity there. Phil, speaking of food and nutrition, blood pressure, we don't want to be, no pun intended, pie in the sky here. Mm-hmm. Not that our show is not about giving medical advice per se, but helping individuals or guiding folks to healthier choices, diet and exercise, as related to heart health.
Well, this is top of mind with the recently released inverted pyramid coming out of Washington, D.C., and trying to understand and make sense of what things should we put in our body to stay healthy, right?
Absolutely.
We know that high sodium is an important part, contributor to both high blood pressure and heart disease itself. We know high-fat diets contribute to early development of atherosclerosis, which leads to blockage of blood vessels that causes heart attacks and strokes. We all have an active role to play in this. And I think between the stress, somewhat social determinants, and in particular diet, we have to own the circumstance. And we can't always afford perhaps the best or most expensive type of meal, but we can certainly eat healthy.
True.
Things like Eastern Market and the things that they do there with Double Up Food Bucks availability to get fresh produce.
Yeah.
Those are the types of things that we really want people to understand. We've done work through American Heart Association supported research looking at what type of menu could you offer people that they can pick and choose items that they know will be heart healthy. I think a lot of us think we know, but we don't always know. I mean, certainly nobody thinks Doritos are healthy, right? That color alone can't be good for you, right?
And then what it does to your fingertips.
Right.
You get Cheeto tips.
You can't hide those.
Exactly. But the point here, right, is that we have opportunities to do things for ourselves. We aren't passive, recipients of badness all the time, right? We can be active, and I think there are a lot of resources, as you mentioned, what the city's doing to promote this, what the American Heart Association is doing to promote this, but what areas we can go to, like Eastern Market. Doesn't have to be on the weekend. You can go during the week and get fresh produce and those things. Some of the work that we're doing in partnership with them is taking mobile markets into communities where we're doing blood pressure screenings and then offering people access to produce. If they can't afford it, we're willing to pay for it. And I think that's a really important thing.
It is.